Well, hey, everybody, welcome to the Seeing Ability podcast, where we're having a conversation about the world of people with disabilities. And that means in some cases, we're going to be talking to adults who grew up with that disability, or we're going to be talking to a lot of folk. We might be talking to parents who are raising kids with the disabilities, or a lot of different people that support this community. It might be folks in education, might be folks in nonprofits, might be folks in healthcare doing various types of therapy or medical services. First of all, I know you have a lot of choices when it comes to podcast and you're listening and your time is really valuable. So I appreciate you tuning in to Seeing Ability. The whole idea behind this podcast and the word and the title, Seeing Ability, is what if we could look at everyone in the world and instead of seeing their challenges, we saw their possibilities? If we take that word disability and we took off the first three letters, what are we left with? Ability. And that's hopefully how I would like folks to see the world. And I think I see some nodding of the heads already. Our two guests today, Abby and Tara, are going to really resonate with you guys, and I think you're going to enjoy it. Abby is an occupational therapist with an organization that has three clinics in Kentucky called Hogg Therapy. And then Tara is a mom that she's had the pleasure of working with her and her son Andy for several years. Ladies, welcome to the podcast.
Hello. Hi, Jim.
Great to have you here. My listeners know we like to start off before we get to the journey, being around and supporting amazing kids who show up differently. We're all just people, so we want to do our fast four. And the fast four is brought to us by my friends at Reliable Tech Help. So for all your IT needs, they're at 502-797-7399. Four quick questions to get to know you, ladies. Number one, we'll start with Mom Tara. Favorite food?
Cheese fries.
I like you already. Abby,
Indian food.
Indian, the two winners. I love it. Okay, number two, we'll stay with Abby. If we were to look at a playlist of yours, what kind of music would we find?
So actually I've been listening to a lot of K-pop, and that is because of my friend Tara here.
Yep. So my playlist looks exactly the same, probably.
Okay, so K-pop it is. All right, we'll stay with you, Tara. Favorite TV show, movie, or book that you've been enjoying lately?
Oh man, I love Parks and Recreation. That is my go-to TV show.
Okay, very good one. Okay,
Yeah.
Abby.
And we're watching through every single episode of Star Trek.
Okay, Star Trek, very good. And then
Oh yeah.
last but not least, if you could go to a bucket list destination, anywhere in the world, it might be somewhere you've never been or somewhere you've been before, but you want to go back. Where would it be? Start with Abby.
Japan.
Japan. Tara.
Oh yeah.
For me, I think it would be London, England. I grew up being a huge Beatles fan, so I think that would be
Okay.
really cool.
London, England. I love it. So Japan and London, very awesome. Okay, we're going to talk now, shift, thank you, ladies, to the journey of raising kids who are different. And Abby, I wanted to start with you and your work as an occupational therapist, OT, as we like to say. You do a lot of work. I think we've done a lot of work with Andy. So I wanted you to talk a little bit about, and you talk a little bit, if you want to share a little bit about Andy's challenges or diagnosis and your journey finding communication for him.
Yeah. So first of all, like I want to start with a story about Andy. And it's a story of how Andy and I first met. And this kind of kicks off everything I know about him and our treatment for him to this day. Um, I remember being at our old clinic in Richmond, Kentucky. It was a little old clinic, sitting crisscross applesauce on the floor. And at the time, we were offering free screenings for whether or not your child would qualify for an evaluation. So like parents who were curious, they could come in. They didn't have to go through all the hustle and bustle of like an evaluation yet. They just want to, you could pop in and do a quick screening and kind of meet with one of our therapists. So that's what Tara and Andy and Tara's mom came in. And next thing I know, this little porcelain skinned, dark haired boy is sitting, plopped himself down in my lap. Um, and I looked up and I was like, I'm used to kids. I've been working in a pediatric clinic, and I just like looked up and I saw Tara and your mom, and they were just looking at me like, oh my gosh, like he does not do this to strangers at all. And so right off the bat, I was like, oh, like I'm honored, like, oh, like that this little boy who, clearly at the time, like, it was kind of clear just from the few minutes that I'd met that he was nonverbal. Um, but obviously like very, very sweet and gentle. And so that was the very first time I met Andy. And, shortly after they got into OT and eventually ended up on my caseload because I had done like a feeding training or something. And
Yep.
so, and it was just meant to be. And ever since then, we've been working together. Um,
Mhm.
as far as like the things that Andy is working on in his communication. So, like I said, he's nonverbal.
Right.
Um, and so from the very beginning, it was kind of something that we had to work through because, of course, he was in therapy for feeding therapy. Andy is a very profoundly picky eater, which is very, for anyone who's listening who knows about autism or autistic people, like the sensory sensitivities can be so extreme that like even the sight of foods can be really aversive. So that's what he was with me for, because this kid eats like Doritos and goldfish and or what was it like
Cheese it.
Cheez-Its. And that's what it has been sustaining, that's what was sustaining this kid. We can get into that later. But all I knew was I was sitting, I was like, okay, I'm a new therapist. I want to teach this kid to eat food. So like I'm bringing in like, carrots and like different, vegetables and fruits and all this fun stuff. And like here I have this kid he's just unhappy. He's crying, he's screaming, he's
Yeah.
running away from me. And at the time I was literally a brand new OT. And so that was my first kind of check-in of I have to do something different when I'm communicating with Andy. So
Mhm.
over the course of the next year, we really changed approaches really drastically to a very, very like naturalistic sensory integration based kind of approach of Andy needs his cup filled with his sensory needs first. He needs to
Mm.
trust me. He needs to trust the space before we do absolutely anything else. And so then the next year we probably spent doing that approach. And
I want to say
I
for like a year.
I want to. Do you have anything to speak to like the
Yeah.
difference
Well,
in
one of
that?
my favorite. Me and Abby have grown really close over 3 years. You know, the relationship between therapist and client is very important, and trusting somebody in that space is also super important.
Yeah.
And one of my favorite stories, kind of to look back on, is what she was saying, like of how Andy kind of gravitated to her immediately, and watching her grow as a therapist over these last few years is just one of my favorite things because she really grew with my son, and I feel like
Mhm.
that's so important as a
Yeah.
therapist. It wasn't just, okay, we're gonna stay here and work on this forever. She adapted herself to my child, and that's just something that
Yeah.
I'm so appreciative of,
Yeah.
so
Um, yeah, and it's been really beautiful to see. Like he has just completely blossomed into this like expressive and loving and
yes.
assertive little boy. And he's starting. He's we had kind of trialed like a AAC, which is an adaptive and assistive communication device, with his speech therapist was working on that. We had introduced that at one point, and it was did not click, and then we kind of took a break from that. And
Yeah, I feel like he
um,
wasn't quite ready for that. I think
yeah.
he thought it was a little overwhelming. And so we kind of took a step back from that, took a little bit of a break, and then I'm sure Miss Abby is going to say we worked on sign language. And he really picked up on that very quickly. And then once he started to realize that we can understand what he was saying,
Mhm.
through the signs that he was making, which sign language is its own language, and it can be difficult to learn, but he really picked up really quickly and was very excited that we could understand, what
Yeah.
he was saying. And I feel like, having that tool for him to grow with his language and being more expressive,
Mhm.
it really played a huge part, I think,
Yeah.
on his therapy and like the things that he was willing to try, willing to do, because he could communicate whether he
Yeah.
wanted to do it or not, or if
Yeah.
he wanted more of it,
Yeah.
So
I
If
love
I
hearing
can,
I love hearing
yeah.
the flexibility and the adaptation that you guys come this journey together. What advice would you have for parents? Because therapy obviously is a big part of the journey for most kids that have any kind of difference, and it's wonderful and you make great progress, but it also is a source of frustration and challenges and making it work for your kid. What do you think is your advice for listeners out there of how they can make that partnership work with the therapist in a good way, or sometimes even if it's not working, maybe try to switch a therapist or get a second opinion, find their voice in
Mhm.
that relationship. Either one of you want to comment on that?
yeah, I feel like I have both sides of the experience. because when my child was about a year and a half to 2 years old, before he started to see Abby and before he came to Hog Therapy, we actually did get a we went to another clinic and he actually got diagnosed with sensory processing disorder there. So he
Mhm.
wasn't diagnosed with autism yet. And he saw a lady there who was very kind. It was also during the pandemic, kind of around there, and so it was mostly telehealth,
Yeah.
which it was kind of frustrating to be, which that was our only option, but it was
Yep.
kind of frustrating to be in that sort of setup and situation because it wasn't very hands on for my son, and I feel like you definitely come to a point of frustration,
Mhm.
especially in that setting when, like I said, it's not very hands-on and trying to get him to pay attention and, look at the screen and like follow directions was very frustrating for sure.
Yeah.
But and we saw her for a few months. She was a very nice lady, but it did not work out. And one of the biggest tips that I can give is do not give up. I think that's one
Mm.
of the biggest things that I can really say is do not give up because therapy is so important. And,
Mhm.
if I had not found, Abby and Hog Therapy, my child would still be in this state of just constant dysregulation, which is why we
Mhm.
took him, to another place beforehand to try to figure out, why is Andy so
Mhm.
frustrated and upset all the time? It's because like I said, he was in a constant place of just being dysregulated
Yeah.
constantly. And so, we actually took a break from therapy for about a year. And then in February of 2022 is when we saw the free screening sign and we
Yeah.
came in and it worked
Mhm.
out. It worked out beautifully. It really did.
Yeah.
So
I love that. Well, that's really
Yeah.
helpful to get both of
I
those
mean,
perspectives. Go ahead, Abby.
say that again, Jim.
No, I said, go ahead.
Oh, I was just going off of what as a therapist, like what I was gonna say is like my advice to any parent that I see at any time is your child best. Like you are the expert in your child. And, I love hearing like Tara's experience of like, okay, shoot, we're gonna try something. And then like if it's not working, we're gonna, take it, we're gonna keep trying
yeah,
because, we know that the research shows that like early intervention is best. And for any parent who's out there who maybe has had like a negative experience with therapy, like I would encourage you to try again. Especially if you're seeing like if something's not right, if something is hard, if there's something that might, you can kind of see that like so they're not performing at whatever that age appropriate is or whatever, if it's a barrier to how you what the things you want to do or need to do in your day-to-day life, communicate, find someone that can listen to you because like I am not a perfect therapist. I'm just someone who listens to Tara, and a lot of the changes that I've made have been because of things that she has voiced to me. And so like I would encourage you to find a clinic, find a therapist that is going to hear you and listen to you because we are meant to be a partner to
yes,
any caregiver or parent that is out there. Um, I'm doing what I do because I love it and because I love, I'm so passionate about it, but I would not be a good therapist at all if I didn't change or modify or adapt based on my clients' needs. And so I would encourage, if you've had a bad experience, try again because we can say firsthand that intervention is can be really, really beneficial and beautiful for
absolutely.
your child. Yeah,
Yes.
and
Yeah, I love
transformational.
I love both of those ideas. One, keep going and try something new. Sometimes even a break is needed. And the other is make sure you're in a partnership where you feel heard and listened to. And that's kind of the key
Mhm.
is working in that partnership. I think that's wonderful. Abby, I was going to ask you a little bit about, we talked prior to this episode about sometimes kids who have differing abilities in their behavior is seen as kind of like defiance and learning how to
Mhm.
work through that and what might be a better lens to see that through. You want to speak to that a little bit?
Absolutely, please. So I'm gonna kind of start with a little model. It's an occupational therapy model, and this is how I explain it to any parent that comes into the clinic. Is I look at it's called the pyramid of learning. Is kind of you can Google it, look it up, and you can kind of see a visual of it. But we have, think of it at the bottom of our pyramid is like all the foundational skills that we need to support our nervous system, our brain, our behavior, our ability to learn new skills. all of those new things that we learn, behavior, anything like that is at the top of our pyramid. So in OT, we look at, if there's a deficit or a delay or something that we want to help a child with, I'm not going to necessarily only work at the top of the pyramid. I'm going to, look at that, and we're going to spend time doing activities and things, but I'm also going to look at all like the foundational skills. And so, as Tara said before, like Andy had received this diagnosis of sensory processing disorder, which can look like many different things. Like maybe you're trying, it can look like a child is sensory seeking, like they're bouncing off the walls. It can look like they're hypersensitive, they're withdrawing. It can look like they just don't even notice the senses or the things in their environment. And with Andy, it was kind of a combination of those, but
Yes. Yeah.
most particularly a motor planning disorder. So what that means for those of you who are not in the therapy speak world is that, like Andy, even if he wanted to do something, his brain was not able to put those steps into place to do it. So Jim, if I were in front of you and doing a jumping jack, you might be able to look at me one time doing that jumping jack and then replicate it, right? And that's a really simple, but it can go as extensive as, okay, like I want you to learn how to play a new toy. I'm going to teach you how to do, how to get dressed in the morning. Like all of those are motor planning things that, as a typically developing adult, like I can look at that, I can create a plan, and I can execute it very seamlessly. And if it's something I need practice with, I can do it a couple times and then I get it.
Yep.
Andy is different. Andy, even if he looked at something, he might need to watch you do something 100 times before he could conceptualize that plan. And so what we're seeing a lot with Andy is we would ask him to do things or show him how to do things, and he wouldn't do it. And a lot of, especially a lot of autistic kids, like that gets identified as defiance,
Yeah.
a bad behavior. And what we find in OT is that when we look at those foundational skills of making sure sensory needs are met, maybe they need some core strength intervention, maybe they need to find something that's just like motivating for, whatever. There could be a million different things. But for Andy, he was not able to do a lot of those things, but it's not because he was being defiant. It was just because we had to take an approach to, to introduce the motor plan. And once he gets that motor plan, and I use this approach with every area: feeding therapy, fine motor skills, gross motor skills, self-care skills. He's really picking up on those things.
Yeah, and I feel like as a parent, that it can be a source of frustration very easily because, like, you're coming to your child and you want them to do, X, Y, Z, and they're not doing it. It's like, well, why can't you just do it? It could definitely be like a source of frustration. So I want to say to the parents out there, if you're frustrated with that, like that's okay. There's absolutely nothing wrong with, being frustrated, but that's why therapy is just so important, is because that's how you address those problems and go forward with your child and teach them, the things that they are struggling with and lacking with. Yeah. So
the biggest
I love
disservice
that.
I see happening is when parents don't give their child the grace to say, hey, I know you're not just being a bad kid.
yeah.
I know, like there's a skill deficit there. Like I'm going to give you the grace to teach you and to find, find the expert who can find those skills and those learning opportunities in order to facilitate, just function and independence and play, so
Well, that
it's a beautiful
changing
thing.
perception about defiance versus an underlying skill deficit is a good segue to another topic that I want to get to in just a second. But first, we're going to just take a real quick break. We'll be right back. When you have a kid who is different, all your ducks need to be in a row, especially your money. Cam Howell with Primerica knows the joys and the challenges as he and his wife raise their medically fragile son, Brooks. Cam brings over 13 years of experience to help his clients be protected, have a plan for the future, reduce debt, and connect to resources. Get your financial house in order so that you can enjoy every moment with your child. Reach out to Cam today at 502 803 5075. And now back to the show. So that perception of behavior versus skill deficit, you said it's a frustrating thing, Tara, can be for a parent. What about the part of the journey for you, Tara, as a parent, and for you, Abby, as a therapist, watching multiple families, public perception? When you have a kid whose behavior can be seen, sometimes it's hard. Your extended family, or you go out into a store and you see the general public. How do you learn to navigate how others see your kid and what that brings up for you and how you navigate that?
that's one of the most trying things I think about being a parent of a child with a disability is that that is a glimpse into, a whole huge world, just a glimpse into just a part of their behavior, you know what I mean? I think, I've had conversations with different family members and I've had conversations with strangers, people I go to church with, who just see one side of it, well, why don't you discipline your child? Why don't you make them eat what you eat? There's so many things that people want to chime in with. And
Right.
while, most of it, I think a lot of people are, good-hearted and they're just trying to help. I
Yeah.
think a lot of people don't realize that type of feedback is not helpful and it can be more harmful because like I said, you're viewing one part of a huge world, that he's involved in and that's, his world. So I think just having grace with yourself in those moments to be like, I don't owe an answer to
Mhm.
everybody. I
Mm,
don't have to
yeah.
have an answer for everybody or explain everybody. When my son first got diagnosed with autism, um, there was a time where I thought, well, I wonder if I should get something for him to wear or something for him to have that says he's autistic and just kind of like,
Mhm.
maybe as like a warning to other people. Not necessarily a warning, but just like, just a tag that says, "Hey, I'm autistic, if I act a certain way, it's because of this." But then, like I said, it just came to the point where it was just like, I don't owe anybody an explanation for the way my child, is trying to interact with the world around him, and I think
Mhm.
a lot of people, they don't realize that this is just my child trying to cope with his surroundings. And
Right.
so just really being patient with yourself as a parent in those moments is so important. And it's okay if you get frustrated. It's okay, if you have all these feelings. That's definitely something I had to kind of work with through myself, to
Mhm.
just be like, it let people perceive however they need to perceive because they don't live your life. They're not in your shoes. And, so
Mhm.
I think just being patient in those moments and just realizing you don't owe people an explanation for why your child acts the way that they do.
Yeah, I
Very
love
trustful
that.
son.
Abby, what would
Yes.
Yes.
your advice be? I know you've probably
My
seen,
favorite thing to say. Go
yeah,
ahead, Jim.
I was gonna say you've probably seen a lot of clients who struggle
Um,
with that piece of it. So what's your advice?
oh yes. No, absolutely. I mean, like, and that's kind of why I love working with pediatric therapy, like in this setting. In other settings, and I've worked in other settings where, like I see patients for like 3 weeks, and then I never see them again. In this setting, I've gotten to know Tara and Andy over the course of 3 years. So I feel like I really get to partner with them um in their journey. My favorite thing to say, I'm sure you've heard me say it, and like, plenty of other families have too, is like my opinion, in the case of Andy, maybe they're worried about like, okay, what and Andy's a picky eater. Like, what if I go out to eat? What about like my family's giving me 2 cents? My doctor's giving me 2 cents. I love to tell them our opinions are the only ones that matter.
Yep.
You should only care what I think, like,
Yes.
you know, and I say that kind of jokingly, but at the same thing, especially in a world, feeding therapy is like my niche, my what I've chosen to specialize in. So that's like where I draw from my experience. But like as far as picky eating kids go, like I grew up in a family of you eat it or I'm going to put it in the fridge and you can eat it later when you're hungry. And if you don't eat it then, you can eat it for breakfast, and as a I'm typically developing kid, like that wasn't an issue for me. But the idea that you're getting Tara's getting that advice from people who have no
Oh
idea,
yeah.
like Andy, who he
He
would
would s-
starve himself,
he would cease to exist. Yes.
and hopefully, I'm sure listeners on this podcast, like, probably very much understand where we're coming from there. But like that process of feeding therapy, like I am not, my end goal for Andy is actually not to be a non-picky eater. He's probably always going to be
Yeah.
a picky eater.
Oh yeah.
But we're working with his strengths. We're working on a process, we're working on a motor planning approach. We're just working with him to get him, as much. We're just going to go as far as we can. We're going to go absolutely as far as we can.
Yeah.
And really, we know, Tara and I are pretty much the only ones that are in on that process. We know our pace. We know the strategies that we're working on,
Yeah.
and we are taking it one step at a time. And really, anyone outside of that has you can have their opinion, but we're not gonna. We have our plan, and we're confident in that.
Yeah.
And so I tell parents all the time, like, it doesn't matter whether it's really hard. It's still gonna get to you, but just tell yourself, like, I've got, that's why, I encourage everyone to have a team, have a team with like therapists you trust, doctors you trust, friends and family you trust.
Yes.
Those are the people that you listen to. Anyone else it should just be white noise.
Yeah.
I love that. So, Tara, question for you. Along the journey of learning how to raise a kid who shows up with differing abilities, how have you learned to become an advocate, kind of become a voice for Andy?
Before I had a child, he's my only child, but before I had him, I really didn't know anything about autism at all. No,
Mhm.
I mean, nothing pretty much. And so watching him grow and, just, I mean, there would be times when I would just hold him on the floor, like in the dark, and just kind of rock him. Like, I mean, he would just be so uncomfortable in his body,
Mhm.
and then, like I said, we found Abby, and she was a huge help in, him learning how to regulate himself. And then once you start to see kind of like the fruits of therapy and you get to see him live his life and like and before he was diagnosed with autism, I think I was in a little bit of a denial, and I think that that's normal for parents. I just want to say
Mhm.
that because it's very hard to just accept that you have a child that has a disability. And I definitely, I came from a place where it was like I knew he had sensory issues, but I think there was a part of me that knew he had autism, but I wasn't ready to hear that yet. And then when he finally was diagnosed with autism, I was like, okay, this is not the end of a journey. This is a start of,
Mhm.
a new journey of, okay, how do I help my child, in this new space, in this new world of accepting that he has autism? Where do we go from here? And then, I've done so much, research and looking into this world, and you see that it's not something to view as a negative, which a lot of our society does. Anybody with a disability really, it was something
Mhm.
negative. But the way my son views the world is just so
Oh,
beautiful,
yes.
and he's happy. And I think being being an advocate for just letting your child with a disability just be their own human, their own person, I feel like
Yeah.
it's just so important.
Yeah.
It's not up to us as parents to try to make our kids fit, in a normal box, so to speak. It's just like let them live, advocate for what makes them excited, what they love, and
Yeah.
you're
This kid's hand flap.
exactly. And
Yeah.
you're gonna see the fruits of that, as they get older,
Yes.
things that you support them in. And it's just I love having, a child with autism because you really, it taught me to look at the world different. I
Right.
never thought of, being excited about like colors red and blue, like just being so excited that those colors exist,
Yeah.
or I'm excited, that like sometimes he'll see like the cop cars, the ambulance cars, and he'll just be very excited about, the colors on the cars and things like that. I mean, you learn how to view the world so differently when you have a child like this. And
Yeah.
there's nothing negative about it. I think it's beautiful, and I love being able to see the world through
Mhm.
his lens. I think that's just really important as a parent to just support
Yeah.
your child and meet them where they are.
I love that.
Yes.
Yeah, and sometimes it makes you wonder when you think of a lot of these kids with a variety of diagnoses and the way they look at the world. You sometimes wonder who's the one with the disability, us or them, right? Like
Right?
the world would
I
be a little
have
bit greater place if we saw the world the way they do. Abby.
I don't know if you've heard this little tidbit of research before, Jim, but this is something new that I've learned in the past year. It is scientifically based, research based. I can't tell you the article off the top of my head, but autistic people and neurodivergent people experience and intake 40% more sensory details from their environment than a neurotypical person. So, and I just think that's very interesting because, like, if you see Andy, right, can I share about like things? Okay, so Andy, like, we do not prevent Andy from stimming, like, unless it's causing unless it's dangerous or self harm. We'll intervene at that time. But he runs around the clinic. He notices, he uses the peripherals of his vision, to like stim, and he shakes things, and it's very specific, and it's very like I've never seen any kid like, and every child with autism is kind of like this. Like you've never seen anything like it. Like they're all experiencing it vastly, vastly differently.
Yeah.
And it's so like I probably every time I see Terry twice a week, so like and probably twice a week the comment gets made like I wish I knew what he was thinking. I
Oh,
wish I knew
yeah.
what he was seeing or saying.
Absolutely.
But yeah, like they're literally experiencing like the world that they live in is 40% more vibrant,
Yeah.
40%, maybe 30, maybe 40% more stimulating. But like, it's for there's more. They're getting more and they're processing more and they're processing it differently. But it's amazing. It's beautiful.
It is.
So Tara, I have a question for you, and then this will go to Abby too, because you work with a lot of different parents, but a real challenging topic for, let's be honest, any of us in general, but any parent, but especially of a parent of a kid with some kind of special need, is self-care. The old oxygen mask, taking care of yourself as a parent, even though all your energy is focused on your child. How has that been a part of your journey? Have you had to learn things about that for yourself as a mom?
Oh, yes. And I will say I'm also a single mom, so I feel like that can make it even more difficult,
Yeah.
and I'm very thankful that I have a good, like Abby said, it's so important to have a team of people
Mhm.
that support you and support your child. And so I'm very blessed that I have my mother around who is a fantastic grandmother to my son. And she, me and her will talk sometimes just about, taking breaks and just, making sure that you take time for yourself. And it's even more difficult. I mean, it's hard enough just being a parent, just to like I said, a neurotypical child. But when you have like, a child that's disabled, sometimes you can feel like, okay, well, I have, this person that I trust to watch my child. But even then, you feel like, okay, well, I understand that cry a little bit better, or I hear something that the other person's not hearing. You kind of
Yeah.
feel like you're fine tuned in a way to where, okay, well, what if this person doesn't pick up on something that, I would pick up on?
Mhm.
And so it's really about trusting like Miss Abby said, the team that you have and just really just giving yourself breaks. I mean, that's just so important. I mean, even if it's 5 minutes just in the bathroom and you just take a minute to just breathe. I mean, I feel like that's self-care, just taking a minute to just breathe and let yourself just have a break for a second, and I feel like I definitely still struggle with that. I'm not gonna lie. It can be really tough to find those moments for yourself, you know. But once you get sort of into a rhythm of doing it every day, I mean, just start at 1 minute or and work up to 2 minutes. I mean, just really breaks are so important, especially for mental health purposes when you're raising. We're raising the future generation. So just taking breaks and making sure that you're calm, cool, collected. I mean, even I've had to do that, because like I said, it, raising a child with a disability is very hard, and sometimes I get frustrated. And I'm like, whoa, I need to step back and
Yeah.
I just need a minute, to just kind of cool down, or because it's not easy. So just
Yeah.
finding those breaks for yourself and being patient with yourself, I feel like it's super important.
Yeah.
Um, I always like the themes that kind of come up of like hearing you speak and like kind of connecting it to the other families that I do get the chance to interact with is like kind of the themes of, balancing roles, and balancing your burnout. We don't think about like burnout necessarily in terms of, that's a word that comes up a lot in our jobs, is like, okay, I'm burnout. Like I dread going to my job. That can happen with anything that you're spending a lot of time doing,
Yeah.
including parenting, especially parenting a child with a disability, and if we look at like the demands of, of that kind of, thing, like there's just a whole world, you do have a hard time taking a break. And that is the one thing
Yeah.
of like, I know we're big advocates of therapy, but like life 24/7 does not have to be therapy and should not be therapy. Like you need those breaks. And like, you have your role of mom, but you also have your role of caregiver of Andy.
Right.
And that is those get blended together a lot. And I can imagine, like, I don't even have kids, you know. I feel like I've got a lot of kids because of my job. Like,
Right. Yep.
even though I don't, experience that personally, like, I see a lot of my parents, like, they're always on in the role of caregiver, and I would say, like, give yourself time to be in the role of mom, like, be in the
Right.
role of dad, be don't be their therapist, don't be their, take care of them, but, like, be present, and that can be really difficult,
Oh,
I
yeah.
would imagine, especially if you have a child that, like, special needs. I mean, it's just that, like, they they just need more, and that is just the nature of it, and that's okay. Um, but I would
Yeah.
encourage, like, look at it through the lens of your role, like, make sure you're the role of, the caregiver, but also make sure you're the role of mom, like, make sure you're the role of, safety
Yeah,
as well.
I love that.
So
Well, I feel like I could talk to you guys for 2 or 3 hours, and I'm sure everybody's enjoying listening, but we do try to keep our podcasts to a time. I'm always the time cop. So I'm going to ask you guys my favorite wrap-up question. We're bringing you in to speak to a group of young parents who have kids with a variety of diagnoses. Could be some on the spectrum, but lots of different challenges. We'll say differently abled kids, right? And you want to give those parents advice. What are the keys to success of raising a child with this kind of difference? I'll go to Abby first and let Tara wrap us up. What are like 2 or 3 big things that you would give them as advice?
I would absolutely, like, know and be confident and you are the expert on your child. Especially when you're seeking, I would, if you feel like you need help, I would seek out help. Like, I would not just try and, if you feel like you need it, like, find a support system that can be therapy. I would encourage it to be therapy. I would encourage it to be, family and friends as well. But know that, like, if you know that you need help, like, find the right person to help you, be the advocate. It might take a little bit of trial and error, but I would say, like, your balance, your quality of life, your child's quality of life, like, it'll probably, like, I've seen it time and time again that that support system is so instrumental and necessary, just for every, just for everything. So, that would be my advice.
I
Yeah.
think number one for me, especially from a parent perspective, is just patience.
Mhm.
Not only patience with, your child, that is also, looking for you, looking to you for support, but patience with yourself to navigate a whole new world that you didn't know you were going to be thrown into, and something that you're having to navigate for the first time. I think patience with yourself is so important. I really do. And another thing is, it's okay to make mistakes. You're gonna
Mm.
make mistakes. You're not gonna be the perfect parent. Nobody's the perfect parent,
Right.
and just, you know, go on this journey with your child and, don't take it for granted. Even the mistakes that, that are hard, to bounce back from sometimes. Learn from them, grow from them. It's gonna make you better. It's gonna make your child better. And, it's gonna make for, mistakes can make things harder, but it's gonna make
Mhm.
for a more fulfilling journey to go on. So
I love it. I'm feeling like there's going to be a lot of listeners who are a little jealous of the relationship that you two have because it's palpable and I can see how
She
close
came to
you
my
are.
wedding, y'all. Like, we're tight.
I'm very blessed to have Abby, that's for
We
sure.
hope we
Yes.
hope everybody could find this for their kids. Well, we know again, everybody listening, you guys have a lot of choices when it comes to where you spend your time. I know that you enjoyed listening to these 2 ladies because I could talk with them for hours. So I know you did. If you enjoyed this episode, we could use your help. Go to our Facebook page for the Seeing Ability podcast. Like the episode, maybe leave us a comment and then share it. Share it with people you know. The goals of this podcast are pretty simple. We always want to educate, and I know I learned stuff today. I'm sure you did too. We all need a burst of motivation, no matter how positive we are. And I know I got that today. And then last but not least, we want this podcast to be another layer of your village, part of your community, a place where you go and you feel understood and seen and connected to. And there's a lot of people out there that don't know about us. So please get the word out. We would love to have your ideas on future guests to have on here. We're doing 2 episodes a month. One is an individual or family traveling this path, and the other is an organization, typically a nonprofit, that is doing work in this space anywhere in the US. So if you've got ideas, message me, reach out to me. Ladies, thank you so much for being here today.
Thank
Thank you so much.
All right, everybody. Again, go to the Facebook page, like, share, comment, and follow the podcast on our Facebook page. We appreciate you listening. We'll see everybody next time.